Hey there, this October, as Breast Cancer Awareness Month rolls around, we're doing something really important. We're cutting through all the noise to bring you the most critical, life-saving information directly from the folks who know it best, the experts. Did you know that a staggering 1 in 8 women will hear those 3 words, "you have breast cancer," in their lifetime? Just think about that for a second. That's not just a statistic, it's a daughter, a mother, a sister, a friend. It's a number that screams for us all to understand how to protect ourselves and the people we love. What you pick up in these next few minutes, it truly could be the game changer for you or for someone incredibly special in your life. So, lean in, because this really matters. Let's be real. Breast cancer isn't just a problem, it's a huge one. It remains one of the most common cancers hitting women worldwide, and tragically, it's the second leading cause of cancer-related deaths among them. Those facts can feel pretty heavy, right? But here's the crucial silver lining, the really good news. We're not powerless against it. Far from it, early detection isn't just a buzzword, it's a lifeline. And proactive choices about how we live our lives, they can dramatically slash your risk and boost your chances of not just surviving, but thriving. In this video, we're not just throwing information at you, we're diving deep into the essential knowledge everyone needs to arm themselves with when it comes to breast cancer prevention and catching it early. It's about empowerment, not fear. Now, we know there's a ton of information out there, and frankly, it can be overwhelming. That's why we've gone straight to the source. To make sure you're getting the most accurate, helpful, and up-to-date insights, we've spoken with some incredible minds in the field. We're talking about leading oncologists who understand cancer treatment inside and out, brilliant radiologists who can spot the tiniest clues, and, perhaps most importantly, incredibly brave breast cancer survivors who are here to share their wisdom and experiences. They're not just experts, they're advocates, and their collective knowledge is going to be invaluable to you. Alright, let's kick things off with what might just be the absolute cornerstone of fighting breast cancer, early detection. Think of regular screening as your very first, and arguably most effective, line of defense. It's like having an advanced warning system. And when we talk about screening, the gold standard, the MVP, is without a doubt the mammogram. This isn't just any X-ray. It's a specialized image that can actually pick up tiny tumors, often long before you or even a doctor could ever feel them. So, who needs one and when? Generally speaking, women aged 40 and older are encouraged to have annual mammograms. It's a routine that could truly save your life. But here's a critical point. If breast cancer runs in your family, or if you have other risk factors we'll chat about in a bit, your healthcare provider might suggest you start screening even earlier. And please, don't put it off. The earlier breast cancer is found, the higher the chances of successful treatment. We're talking impressive numbers here. About 66% of breast cancers caught at that localized stage boast an incredible 99% 5-year survival rate. That's why we say, don't wait, schedule your mammogram today. It's a quick appointment with potentially life-changing results. Beyond mammograms, there are other important tools in the early detection arsenal, especially for those at higher risk. Clinical breast exams, performed by a healthcare professional, are another layer of scrutiny. They involve a doctor carefully feeling your breasts for any changes or lumps. For women under 50 with a high risk, or those with dense breast tissue, a magnetic resonance imaging (MRI) scan might be recommended. MRIs offer a different, highly detailed view of breast tissue. And if a lump is found, an ultrasound can help doctors determine if it's a solid mass or a fluid-filled cyst. Ultimately, if something suspicious is identified through any of these methods, a biopsy, where a small tissue sample is taken for examination, is the definitive way to confirm a cancer diagnosis. Each of these tools plays a vital role in ensuring we catch anything concerning as soon as possible. Next up, let's talk about something incredibly personal and empowering: breast self-awareness. Now, you might hear conflicting things about traditional self-exams. While clinical studies haven't definitively shown that regular, structured self-exams significantly reduce mortality rates, that absolutely doesn't mean your role at home isn't crucial. Quite the opposite, the real power lies in becoming intimately familiar with your own breasts. Knowing what's normal for you is key. When you know your baseline, you'll be much quicker to notice any subtle changes, and that awareness can prompt you to seek medical advice sooner. So, how do you do this? Choose a comfortable, relaxed time. You can do it in front of a mirror, looking for any changes in size, shape, or contour, or while lying down, which can make it easier to feel tissue changes. Using the pads of your fingers, gently feel your entire breast area, including your armpit, in a circular motion. You're looking for anything new or unusual. A lump, thickening, pain, skin changes, nipple discharge, or anything that just doesn't feel right. If you do notice anything, any lump, persistent pain, or a change that worries you, please, don't hesitate. Reach out to your healthcare provider promptly. They're there to help you figure out what's going on, and peace of mind is priceless. Before we dive into lifestyle changes, let's get a little more educated about what can actually increase your risk of breast cancer. It's not about fear-mongering, it's about understanding so you can be proactive. One of the biggest factors, which we can't change, is simply getting older. As we age, our risk naturally goes up. Another significant player is exposure to estrogen, produced by our bodies. The longer our bodies are exposed to higher levels of estrogen over a lifetime, the higher the risk can be. This is why factors like starting menstruation early or experiencing menopause late, or having late or no childbirth, can subtly increase risk, because they mean more years of estrogen exposure. Dense breast tissue is another often overlooked risk factor. It can make mammograms harder to read, potentially masking tumors. If you know you have dense breasts, it's a great conversation to have with your doctor about additional screening options. Then there's hormone replacement therapy, HRT. While it can be very helpful for menopausal symptoms, certain types and durations of HRT can increase breast cancer risk, so it's something to discuss thoroughly with your doctor. And of course, family history. While only about 5 to 10% of breast cancers are considered hereditary, linked to specific gene mutations like BRCA1 and BRCA2, if breast cancer runs in your family, especially among close relatives or at young ages, it's absolutely worth exploring. Genetic counseling and testing options are available and can give you invaluable information about your personal risk profile, empowering you to take more aggressive preventative measures if needed. It's also important to remember that men, though less commonly, can also develop breast cancer, with risk factors including radiation exposure, high estrogen levels, and a family history. Knowing these factors isn't meant to scare you, but to inform and empower you to have better conversations with your healthcare team. Now for the really empowering part. Understanding that you have a significant amount of control over your health. There are several simple, yet incredibly impactful, lifestyle choices you can make to actively reduce your breast cancer risk. These aren't magic bullets, but they are powerful allies in your corner. This one is huge. Obesity, particularly after menopause, is a known risk factor for breast cancer. Why? Because fat cells produce estrogen, and as we just discussed, more estrogen can mean higher risk. So, eating a balanced diet rich in vibrant fruits, leafy vegetables, and wholesome whole grains, while limiting processed foods, isn't just about looking good. It's about actively protecting your body. It's about fueling yourself for health. Get moving. Aim for at least 150 minutes of moderate aerobic activity, like a brisk walk, or 75 minutes of vigorous activity, like running, each week. Exercise does wonders. It helps you maintain a healthy weight, regulates hormones, boosts your immune system, and generally makes you feel fantastic. It's a true full body, mind and soul investment. This might be a tough one for some, but studies consistently suggest that even moderate alcohol consumption can nudge your breast cancer risk upward. If you choose to drink, and many of us do, try to do so in moderation. That means up to 1 drink per day for women. It's about being mindful and making conscious choices for your long-term health. For new mothers, here's another wonderful benefit of breastfeeding. It may actually lower your risk of breast cancer. While the exact mechanisms are still being researched, it's thought that breastfeeding reduces a woman's total number of lifetime ovulatory cycles, which in turn means less exposure to certain hormones. It's a beautiful, natural choice that benefits both you and your baby. We touched on this earlier, but it bears repeating. If breast cancer is a recurring theme in your family, don't just worry about it, talk about it. Speak with your healthcare provider about genetic counseling and testing options. Understanding your genetic blueprint can empower you to take highly personalized, proactive measures, whether that's earlier screenings, more frequent checkups, or even preventative medications. Knowledge truly is power here. So, as we wrap up, let's boil it all down. Awareness and early detection aren't just good ideas. They're your absolute best allies in the ongoing fight against breast cancer. Remember, regular screenings like mammograms, becoming intimately familiar with your own body through self-awareness, and making those smart, healthy lifestyle choices we discussed can dramatically impact your risk and improve your outcomes. This October, during Breast Cancer Awareness Month, we aren't just asking you to listen. We're encouraging you, from the bottom of our hearts, to take charge of your health. Don't put it off another day. Schedule that mammogram. But don't stop there. Empower your friends, your sisters, your mothers, your loved ones with the knowledge you've gained today. Share this video, spark conversations, and let's spread this vital awareness far and wide. Let's work together to cultivate a community that doesn't just talk about breast cancer, but actively supports each other in this fight. You possess the incredible power to make a tangible difference, not just for yourself, but for every single person you care about. Thank you for tuning in, for caring, and for being a part of this movement. Let's make this month a true beacon of education, empowerment, and hope. If you found this video helpful, please like and share it with friends. Don't forget to subscribe for more health-related content and let us know your thoughts in the comments below. You are invited to subscribe to Camaraderie Health Agency YouTube channel or go to www.camaraderiehealthagency.com or call 224-433-5754.